And we're very excited today to have with us Peter Bell. Peter is the Executive Vice President for Programs and Services at Autism Speaks. And Peter, it is so great to have you with us today.
Thank you for having me. It's great to be with you both.
Well, it's our extreme pleasure. Peter, we wanted to start off by talking a little bit about your background, who you are, because first and foremost, you're a dad, and one of your children happens to be on the spectrum. Is that correct?
That is absolutely correct. That's my favorite title, is being the dad of three wonderful children. The oldest, Tyler, just turned 20 last week, is on the spectrum.
Amazing. And your background, how did you come to hold a position at Autism Speaks? Because this was not your first autism gig, so to speak, right?
Well, I guess it is if you think of the predecessor organization that was part of Autism Speaks, Cure Autism Now. Like many parents, I got recruited into autism maybe the hard way, and when Tyler was diagnosed right after his third birthday. I had previously, or during that time, I was actually working for Johnson & Johnson, which, as many people know, is a very large healthcare organization, and I ended up being with them for 12 years, but I left in 2004 to become the president and CEO of Cure Autism Now, a role that I had for 3 years prior to CAN merging with Autism Speaks in 2007. And so the second stint that you're referring to is the role that I played at Autism Speaks, which is heading up our programs and services area, which includes both family services as well as government relations.
You're sort of one of those people that we say, you didn't choose this path, it was chosen for you. You had this amazing background, thankfully, and you know, when your son was diagnosed, you put all of your skills and passion into that, and we're all the much better for it, I might say.
Absolutely, absolutely.
So tell us about your role now at Autism Speaks, Peter, and what exactly does it mean to be Executive Vice President of Programs and Services? Autism Speaks has so many programs and services. Can you tell us a little bit about what you oversee there?
Sure. So mission at Autism Speaks, which is really to improve the future for those who are living with autism. And we do that through a variety of ways. We have what we refer to as a four-pillared mission. The largest source of investment that we make is in science. We ultimately want to understand and solve autism to the extent that we can, and for those who are interested. And so we do invest quite a bit of our fundraising into really understanding autism at a scientific level, and hopefully one day developing better treatments and ways in which we can improve the quality of life for those that are living with autism. But for the time being, we also are fortunate that we can use many of the resources that we receive to advance services that are available for families that are affected, as well as the individuals themselves, obviously. And then we're also quite busy in Washington, D.C. and state capitals across the country in terms of our advocacy efforts and making sure that both the federal government as well as states are very much committed to helping to make the lives of those who live with autism better. So really what I spend most of my time doing is advancing both family services and government relations. On behalf of Autism Speaks, I also serve as an advisor to the science team to make sure that they're always looking at research that is relevant for our kids and those that we love that are on the spectrum. And so that consumes quite a bit of my time.
I can imagine. I can imagine. And you mentioned the legislative front, Peter. You have been, in your role at Autism Speaks, and the organization has played probably the primary role in getting the states to cover insurance for ABA therapy. Can you speak a little bit about that and your efforts behind that?
Sure. Well, it starts back in 2007, which ironically was the same year that Cure Autism Now and Autism Speaks merged. And for those who might remember, and I'm sure there are many families out there who remember the day that we all used to beat our head against the wall. We still do probably, but you know, insurance companies by and large really didn't feel any responsibility providing care and coverage for individuals who had autism, let alone even think about providing coverage for the behavioral treatments that we all know work and our children have benefited from for many, many years. But there was a mom from South Carolina by the name of Lori Unum who put her incredible skills to good use, and she was successful in passing what essentially was really the second state to enact a law that required insurance plans or health plans to provide coverage for autism treatments, and specifically for the behavioral treatments, as in addition to the other biological or biomedical kinds of treatments that are available. And there certainly were a number of other efforts that started at that time. I think one of the wisest things that we ever did at Autism Speaks was to immediately go and hire Lori to be doing that on our behalf, and we did that in the early part of 2008. And since then, as many people probably know, we now have 32 states in the country representing 75% of the American population in those states that have passed a law that require health plans to provide that kind of coverage. We've been very active also at a federal level, looking at other health plans. We certainly can talk about some of our efforts in the domain of TRICARE, which is a health plan that is available for military families, as well as the federal employee health plans, which are for civilian employees of the federal government. And there's also a very important provision in the Affordable Care Act, sometimes referred to as Obamacare, that is very relevant and important for the autism community as well. So we work off of the assumption that every family in America really should have access to these treatments that we know work with our children and really will give them the best chance of being able to live a life of independence, meaningfulness, and really being everything that they can be if given the opportunity to have their autism treated in an effective manner.
Well, and I want to say, first of all, kudos for an amazing amount of states to have insurance reform, and to thank you, because we feel it on a daily basis, the difference that can happen.
Well, I am one of the lucky parents of a child who is currently having his ABA coverage, his aid at school, as well as his home behavioral plan covered by insurance. And I want to tell you, Peter, I want to thank you directly, because I can't tell you the profound impact that has had on my family. And as you know, as Executive Director of ACT Today, Autism Care and Treatment Today, we are helping families with some of the co-pays for their insurance so they have access. So this is such a huge accomplishment. Do you feel this is possibly your greatest accomplishment with Autism Speaks?
I think it ranks up there very high. I don't want to diminish anything else that we've been able to accomplish, but I think it clearly is one of the things that we can look at where we've had a really profound impact on literally thousands of families and individuals that have autism. We get the stories all the time. I'm so comforted to hear that it's been directly effective for your son and your family as well. So
thank you.
Yes, but we are very proud. But that being said, we also recognize that with all these laws that we've been able to pass and so forth, probably still more than half of the families do not have a health plan that has a requirement to provide this kind of coverage.
Right, and that's obviously something we need to push for. I also want to commend you for your efforts on behalf of military families with the TRICARE. We have a special fund to help military families with treatment and care, and you've worked so hard on the legislative front, and I know it's made a huge difference.